Garlic, ginger, turmeric, olive oil, and beetroot, these are not just kitchen staples, they are powerful allies for your blood vessels. If you are over 70 or caring for someone who is, what you do every single day can either protect your circulation or quietly allow it to decline. Let me begin with a simple truth. Blood flow is life. When circulation weakens, every organ feels it, your heart, your brain, your legs, even your memory. The good news is that your body has an incredible ability to repair and restore itself when given the right signals. Here's something most people don't realize. Poor blood flow doesn't suddenly appear one day. It develops silently over years, narrowing vessels, stiffening arteries, and starving tissues of oxygen. Doctors see the consequences: everyday leg pain while walking, cold feet, slow wound, healing, dizziness, fatigue, and increased risk of heart attack and stroke. After the age of 70, these risks rise sharply, not because aging is a disease, but because the body needs more support. Poor blood flow after the age of 70 is often misunderstood, and that misunderstanding can be dangerous. Many people assume that cold hands, leg pain while walking, dizziness, fatigue, or slower thinking are simply part of getting older. In clinical practice, this assumption delays care and allows silent damage to progress. Aging itself does not cause circulation to fail. What changes with age is the body's margin for error. When blood flow declines, vital organs receive less oxygen and fewer nutrients. And the consequences can be serious, progressive, and sometimes irreversible if ignored. At the center of this issue is the vascular system, particularly the inner lining of blood vessels known as the endothelium. This layer acts like a biological control center, regulating how wide or narrow vessels become, preventing unnecessary clotting, and controlling inflammation. In younger years, the endothelium responds quickly and efficiently. After 70, however, years of oxidative stress, low-grade inflammation, inactivity, and metabolic strain can weaken the system. When the endothelium loses flexibility, arteries stiffen, circulation slows, and pressure inside the vessels rises. This is not an abstract concept. It directly affects how well the heart pumps, how clearly the brain functions, and how strongly the legs can carry the body. One of the earliest warning signs doctors notice is reduced blood flow to the lower limbs. Patients may describe heaviness, cramping, or pain when walking even short distances. This condition, known as peripheral arterial insufficiency, significantly increases the risk of falls, disability, and loss of independence. At the same time, reduced circulation to the brain may show up as forgetfulness, slower processing, or poor concentration. These symptoms are frequently dismissed as just aging, yet they often reflect insufficient oxygen delivery to brain tissue. The heart, too, is affected. Narrowed or stiffened vessels force the heart to work harder, raising the likelihood of hypertension, arrhythmias, heart attack, and heart failure. There is another critical concern that receives far less attention. Impaired circulation weakens the body's ability to heal. Wounds take longer to close, infections linger, and recovery from illness becomes slower and more complicated. This happens because immune cells and repair factors travel through the bloodstream. When flow is compromised, the body's defense and repair systems are delayed. In older adults, this delay can mean the difference between a simple recovery and a prolonged hospital stay. What makes poor blood flow particularly dangerous after 70 is its silent progression. Unlike pain from an injury, circulation problems can worsen quietly over years. Plaque builds gradually, inflammation persists at low levels, and blood vessels slowly lose elasticity. By the time symptoms become obvious, significant vascular damage may already be present. This is why physicians emphasize early recognition and daily preventive care, rather than waiting for severe symptoms to appear. It is also important to understand that circulation problems amplify other health conditions. Diabetes, high cholesterol, high blood pressure, and sedentary behavior all place additional stress on blood vessels. When these factors combine in later life, the risk multiplies. Reduced circulation is not an isolated issue. It interacts with nearly every chronic condition seen in older adults, accelerating decline if not addressed. Yet, there is a powerful and hopeful truth supported by medical research. Blood vessels remain biologically active even in advanced age. The vascular system can respond to positive signals such as improved nutrition, gentle movement, stress reduction, and anti-inflammatory support. When these signals are consistent, endothelial function can improve, nitric oxide production can increase, and circulation can become more efficient. This adaptability is why doctors stress that poor blood flow should never be accepted as inevitable. Recognizing reduced circulation as a medical warning rather than a normal life stage changes everything. It shifts the focus from passive acceptance to active protection. When blood flow is supported early and intentionally, it preserves mobility, mental clarity, resilience, and independence. After 70, circulation is not just about preventing disease. It is about safeguarding the systems that allow the body to function with strength and dignity each day. Supporting blood flow at an advanced age requires more than general nutrition advice. It demands targeted nourishment for the blood vessel lining itself. The endothelium is not simply a passive barrier inside the arteries. It is a metabolically active organ that senses nutrients, responds to chemical signals, and determines how efficiently blood moves through the body. When this lining is nourished correctly, vessels relax, inflammation quiets down, circulation improves. When it is neglected, stiffness, narrowing, and impaired blood flow gradually take over, even if no obvious symptoms are present. One of the most powerful ways to influence endothelial health is through specific foods that activate protective biological pathways. Garlic, for example, contains sulfur-based compounds that directly stimulate the production of nitric oxide, a molecule essential for widening blood vessels. Nitric oxide allows arteries to relax and improves the delivery of oxygen to tissues. In older adults, natural nitric oxide levels tend to decline, which is one reason circulation weakens. Regular intake of garlic sends a signal to the vascular system that flexibility is still required, encouraging vessels to respond rather than remain constricted. Ginger contributes through a complementary mechanism. It supports circulation by improving blood fluidity and reducing oxidative stress within vessel walls. As blood becomes thicker with age and dehydration, it encounters more resistance while traveling through narrowed arteries. Ginger helps counter this effect, allowing blood to flow more smoothly and efficiently. It also modulates inflammatory pathways that silently damage the endothelium over time, especially in individuals with metabolic stress or chronic low-grade inflammation. Turmeric plays a critical role in protecting the structural integrity of blood vessels. Curcumin, its active compound, has been shown to reduce inflammatory signaling and inhibit the progression of arterial plaque formation. In aging arteries, inflammation is a major driver of stiffness and narrowing. By calming this internal inflammation, turmeric supports elasticity and reduces stress on the vascular wall. When absorption is enhanced, turmeric becomes a daily message to the body that repair and protection are priorities, not luxuries. Extra virgin olive oil stands apart as a cornerstone of vascular nutrition. Rich in monounsaturated fats and polyphenols, it feeds the endothelium while shielding it from oxidative damage. These compounds improve endothelial responsiveness, allowing blood vessels to dilate more effectively in response to demand. Populations that use olive oil as a primary fat source consistently show lower rates of cardiovascular disease, even in older age. This is not coincidence. Olive oil alters gene expression within endothelial cells, promoting resilience and flexibility rather than rigidity. Beetroot introduces another powerful vascular signal through its natural nitrate content. These nitrates are converted in the body into nitric oxide, directly enhancing blood flow and lowering vascular resistance. The effect is measurable: improved walking endurance, better oxygen delivery to muscles, and enhanced cerebral circulation. For older adults, this translates into practical benefits such as reduced leg fatigue and improved mental clarity. Beetroot essentially reminds the circulatory system how to respond dynamically to the body's needs. What makes these foods especially effective is their synergy. Each one supports the endothelium through a slightly different pathway, yet all converge on the same goal: restoring healthy vascular function. This is not about isolated nutrients, but about consistent biochemical messaging. Every meal becomes an opportunity to either inflame or heal blood vessels. Over time, these repeated signals determine whether arteries remain adaptable or become progressively rigid. It is also important to recognize that endothelial nutrition is cumulative. The benefits are not dependent on large doses or short-term interventions. Small, daily exposures to these protective compounds create an internal environment that favors circulation. This approach aligns with how the vascular system actually functions, responding gradually to repeated, consistent signals rather than dramatic, one-time efforts. When nutrition is used intentionally to support the endothelium, it shifts the trajectory of vascular aging. Blood vessels retain their ability to respond, adapt, and deliver life-sustaining oxygen efficiently. For individuals over 70, this targeted nutritional strategy is not merely supportive, it is foundational to preserving mobility, cognitive function, and cardiovascular stability in the years ahead. Circulation is not maintained by food alone. It depends heavily on daily physical signals that tell blood vessels how much work they are expected to do. Among these signals, gentle movement and proper hydration play a central role, especially after the age of 70. When the body moves, even at a low intensity, muscles contract and relax, acting as natural pumps that assist the heart in moving blood through the arteries and veins. Without this regular stimulation, blood flow slows, pressure increases in certain areas, and vessels gradually lose their ability to respond efficiently. As people age, it becomes common to reduce movement out of fear of pain, imbalance, or fatigue. Unfortunately, this reduction sends the wrong message to the circulatory system. Blood vessels are highly adaptive. When movement decreases, they begin to narrow and stiffen because demand appears low. Over time, this leads to poorer circulation, increased clotting risk, and reduced oxygen delivery to tissues. Even brief periods of inactivity can produce noticeable effects, which is why doctors emphasize consistency over intensity. A short daily walk, slow stretching, or light household activity can significantly improve vascular responsiveness. Walking holds particular importance because it engages large muscle groups in the legs, where circulation problems often first appear. Each step creates rhythmic muscle contractions that push blood upward against gravity, reducing pooling in the lower extremities. This action helps prevent swelling, discomfort, and the sensation of heaviness in the legs. Over time, regular walking improves endothelial function, encouraging blood vessels to widen when needed and remain flexible under stress. Many older adults report that consistent walking restores confidence in their balance and endurance, reinforcing a positive cycle of movement and circulation. Breathing patterns also influence blood flow in powerful ways. Slow, deep breathing activates the parasympathetic nervous system, reducing stress hormones that constrict blood vessels. Shallow, rapid breathing, common during anxiety or inactivity, keeps the body in a state of mild tension, limiting circulation to the extremities and increasing blood pressure. Just a few minutes of controlled breathing each day can lower vascular resistance and improve oxygen exchange. This practice supports blood flow to the brain and heart while reducing unnecessary strain on the cardiovascular system. Hydration is often underestimated, but remains one of the simplest ways to support circulation. Blood is composed largely of water, and when hydration levels drop, blood becomes more viscous. Thicker blood moves more slowly through narrow vessels and places additional workload on the heart. Older adults are particularly vulnerable to dehydration because the thirst response weakens with age. By the time thirst is noticeable, mild dehydration may already be present, subtly impairing circulation and increasing the risk of dizziness, fatigue, and clot formation. Adequate hydration helps maintain optimal blood volume and pressure, allowing nutrients and oxygen to reach tissues efficiently. It also supports kidney function, which plays a critical role in regulating blood pressure and electrolyte balance. Regular fluid intake throughout the day, rather than large amounts at once, creates a steady internal environment that favors smooth blood flow. Warm fluids can further enhance circulation by gently dilating blood vessels and promoting relaxation. Movement and hydration work together in a reinforcing manner. Physical activity increases circulation demand, while hydration ensures that blood can meet that demand without resistance. When one is present, without the other, benefits are limited. A hydrated body that remains inactive still experiences sluggish blood flow. Why? Movement in a dehydrated state places unnecessary stress on the heart and vessels. Balanced daily habits create the most favorable conditions for vascular health. What makes these practices especially valuable after 70 is their accessibility. They do not require equipment, prescriptions, or strenuous effort. They rely on the body's natural design, which responds immediately to physical and chemical signals. Every step taken, every deep breath, and every sip of water communicates safety and support to the circulatory system. Over time, these signals accumulate, shaping how blood vessels behave at rest and under stress. The result is improved endurance, reduced discomfort, steadier blood pressure, and enhanced mental clarity. When gentle movement and proper hydration become daily priorities, circulation is no longer left to chance. It is actively guided towards stability and resilience. The long-term health of circulation after the age of 70 is shaped far more by consistency than by dramatic interventions. The body does not respond best to extremes. It responds to repetition. Small daily habits, when practiced without interruption, send powerful biological signals that protect blood vessels, preserve mobility, and maintain independence. What appears insignificant in a single day becomes transformative over months and years, especially in the vascular system, which is designed to adapt gradually to repeated input. Consistency stabilizes the internal environment in which blood vessels function. When meals are balanced daily, movement is predictable, hydration is maintained, and stress is managed, the endothelium operates under favorable conditions. This stability reduces inflammatory fluctuations that damage vessel walls and accelerates the repair processes that keep arteries flexible. In older adults, where recovery capacity is naturally slower, avoiding repeated stress is just as important as promoting healing. Regular routines reduce strain on the heart and minimize sudden changes in blood pressure that increase cardiovascular risk. One of the most profound effects of daily habits is their influence on independence. Circulation directly affects muscle strength, joint health, and balance. When blood flow is steady, muscles receive adequate oxygen and nutrients, allowing them to maintain tone and responsiveness. This supports safe movement, reduces fall risk, and preserves confidence in daily activities. The ability to walk comfortably, stand without dizziness, and move without fear has an enormous impact on quality of life and self-reliance. Mental clarity is also closely tied to consistent circulation support. The brain consumes a significant portion of the body's oxygen supply, and even slight reductions in blood flow can impair attention, memory, and decision-making. When daily habits protect cerebral circulation, cognitive function remains sharper, mood is more stable, and fatigue is reduced. This cognitive resilience allows older adults to remain engaged, socially active, mentally independent, reinforcing emotional well-being alongside physical health. Small habits also play a critical role in emotional regulation. Chronic stress constricts blood vessels and elevates blood pressure, placing continuous strain on the cardiovascular system. Consistent calming practices such as gentle breathing, predictable sleep schedule, and mindful routines lower stress hormones and allow vessels to remain relaxed. Over time, this reduces the cumulative damage caused by repeated stress responses. The nervous system learns that the environment is stable, and circulation adjusts accordingly. What makes consistency especially powerful is its effect on long-term risk reduction. Cardiovascular events rarely occur without warning at the biological level. They are often preceded by years of vascular stress, inflammation, and impaired blood flow. Daily protective habits interrupt this progression, slowing or even reversing harmful changes. While a single healthy choice may not produce immediate results, repeated choices compound, significantly lowering the likelihood of serious events and hospitalization. Consistency also strengthens the body's responsiveness to other interventions. When circulation is supported daily, medications work more effectively, physical therapy produces better outcomes, and recovery from illness is faster. Blood flow delivers treatments where they are needed, and removes metabolic waste more efficiently. This integrated benefit is particularly important in older adults who often manage multiple health conditions simultaneously. Perhaps most importantly, small daily habits are sustainable. They do not rely on motivation spikes or physical strength that may fluctuate. They become part of identity and routine, reducing the mental burden of decision-making. When health-supportive behaviors are automatic, adherence improves, and benefits persist without constant effort. Over time, these consistent actions protect not just the heart and blood vessels, but the ability to live with dignity and autonomy. Circulation becomes a foundation rather than a limitation. Through steady, intentional daily habits, the body is continuously reminded how to function efficiently, adapt to stress, and maintain vitality well into later years. Let me close with this. Your blood flow is your lifeline. After 70, it deserves respect, care, and daily action. Small steps, done consistently, can make a profound difference. Your body is still capable of healing if you give it the chance. Take that step today, because circulation is not just about living longer, it's about living better.